Hello, everybody. Welcome to the Rare Disease and Mental Health webinar today. Thank you very much for joining us. We're just going to give it a couple of more minutes and let people sign in, and then I'll introduce the panel to everybody. I would like to point out some housekeeping. If you have any questions, can you please put them in the question and answer box rather than the chat? But please feel free to chat, introduce yourselves, tell us where you're from. Thank you. And we'll start in a minute. Hi, everybody. For those who have just joined us, if you'd like to pop your name in the chat box and tell us where you are, that would be really good. Let's see who we have got from across the globe. And once again, if during the webinar, if you have any questions for the panelists, please could you pop them into the question and answer box, and we'll do our best to try and answer them. Thank you. Okay, I think maybe that's a cute time now to sort of get things moving and on the go. We possibly have another panelist joining us. So there was a short delay while we were hoping for her to join us, but I think it's time now to press on. So I'd like to once again welcome everybody. Thank you very much for taking time out today to join this wonderful panel of people. It's a very topical topic, should we say, mental health and rare disease. Something that really should be talked about more. And everybody on this panel here today, very, very hungry to talk to each other about it, but also to talk to you. So without further ado, I would like to introduce them to you. First of all, hello, Emily. Would you like to introduce yourself, please?
Hi, thank you so much. My name is Emily Parks. I'm based outside of the Washington, D.C. area in the United States. My organization, POP, is about the communication between patients and providers. So that includes empathy, trust, active listening, and what's detrimental about that not occurring is the distrust and the disengagement between patients and providers, which can result in things like medical trauma, medical PTSD, anxiety, depression, and overall poor treatment outcomes and burnout for both patients and providers. So my organization is called POP. It stands for Pissed Off Patients. And it is, really bringing awareness of that to patients and providers, doing a couple of mini projects such as outreach resources, discussion groups, hopefully doing some research soon, some modules, just to bring together how all of this combines to something that both patients and providers, are aware of, to strengthen the relationship between them. This is especially pertinent for rare diseases because a lot of, rare diseases kind of, of course, you see the doctor all the time. There are a couple of rare diseases where you don't have to see the doctor all the time, but it's a lot of doctor appointments, especially while you're figuring out your diagnosis or maintaining your illness if you have the diagnosis. So people with rare disease and chronic illness are more at risk of medical trauma because they have to interact with the healthcare system more.
Thank you, Emily. Thank you. Jenny, would you like to introduce yourself as well, please?
Sure. Emily, I love that acronym and the name Pissed Off Patients. I think we definitely need to talk because I've had a lot of people tell me stories related to your group. So, hi everyone, my name is Jenny Young. I'm a trained marriage and family therapist. I also have a PhD in family science, which means that I study families and family relationships and interpersonal relationships. I have been working in the rare disease and mainly genetics and rare disease space for about 8 years now. I started at the National Cancer Institute during my PhD program, working with families that had rare cancer genetic syndromes. And then I have been at Stanford for 4 years as a postdoc, working with the Undiagnosed Diseases Network there, doing a lot of in-depth research, lots of interviews, spending a lot of time with families, getting to know them, getting to know about their experiences, both living with a rare disease and interacting with research as well, and kind of how we can improve that system, especially with regards to involving more racially, economically diverse participants, people with rare disease from kind of different backgrounds, so we can get more representative data. I'm currently working at Northwestern University part-time as a visiting scholar here at the Center for Genetic Medicine. I use my skills as a marriage and family therapist to train genetic counselors actually, and how they can work best with families. So I'm excited. This is such an important topic. I'm so happy that this panel is happening, and I'm really excited to be here.
Thank you very much. And yes, it is. And a lot of people don't realize that side of mental health, and especially with respect to genetics and patients getting genome sequenced. I myself I'm just currently going through that myself as well, with genetic counseling and stuff. So I praise people like you and the work that you do. And we have Robin, I think. Hello, Robin.
Hi, I'm so sorry that I'm running late. I'm sorry, I thought it was at noon.
It's okay. It's nice to have you join us. And I'm sorry to drop on you straight away, but could you please say hello and introduce yourself?
Sure, I'd love to. Hi, my name is Robin Powers. I'm 34 years old. I'm a master's student as well as a recent graduate of a program through Buffalo State College with a Bachelor's of Science in Biochemical Pharmacology of Rare Diseases. I've been integrated with the rare disease community for a long time, and for about 5 years I've been advocating for free publicly, but for 20 years I've been advocating myself, and I'm also a rare disease caregiver for my son. Thank you.
Thank you very much. Next up, Frank Riviera. Many of you will know Frank from the sarcoidosis communities. He's a president of 2 charities. Go ahead, Frank, please. Can you tell everybody who you are? Thank you.
Hi, everyone. My name is Frank Rivera, president of Sarcoidosis of Long Island and Stronger Than Sarcoidosis. I've been involved in the rare disease community for 11 years and had my organization for Sarcoidosis of Long Island for 10 years, and Stronger Than Sarcoidosis is going on 2 years. But I've been really pushing mental health as well as male mental health, as David is as well. It's just been, I've seen it in my community, and then talking to other communities, I've seen how much it has impacted. Unfortunately, in the sarcoidosis community, I know of 18 people who committed suicide. due to the pain. So yeah, it's been, and I actually can tell you that I actually attempted suicide. I actually put myself in a 72-hour watch. So mental health is very near and dear to my heart. And I have a counselor for 11 years. And I always say she has saved my life. And I do highly recommend for everybody to talk it out. So thank you, Carole.
Thank you very much, Frank. And thank you very much for sharing that. Not many people, especially men, feel comfortable talking about that and their experiences. And that leads me to David, who initiated this and with the support of Frank, brought this webinar together for us all today. And David has founded and set up a group for men with mental health issues who want to talk to each other, and also for male caregivers, really filling a gap there that really wasn't there. And it's good to be able to support such communities like that. So David, can you possibly introduce yourself as well, please?
Yeah, thanks, Carole. Yeah, hi everyone. Yeah, my name's David from the UK. I have a rare disease called Caregiver syndrome. And almost 2 years ago, I set up a group with the help of Mike, who I think is in the audience. And it's basically for guys to get together on Zoom once a month to talk about the mental health side of living with a rare disease, whether that be a patient or caregiver, and kind of just get together, support each other, build each other up, and kind of like provide a space really that I felt, with the exception of Frank and what Frank's doing, wasn't really there for the community.
Yeah, thank you, David. And yes, a shout out there to Michael, who is out there in the audience, who also co-runs this group with David. Thank you. And I think with that, I think we should press on, because we've got lots of questions and probably not a lot of time. So I'd like to go to the first question, which is to all the panelists that are here today. And that is, why is mental health really important when you are living with or are impacted by a rare disease? Who would like to start off, please? Do I have to pick?
I can start. I would say that's really important when dealing with a rare disease that you're impacted with, because, well, I mean, Frank was so brave to say it before, but I also tried to commit suicide when I was a teenager, because they said they gave up on me. They said that we can't figure out what's wrong with you. We'll treat the pain for as long as we can, but we feel like there'll be some problems with that, you know, and so here's a bottle of painkillers or whatever, and then just out the door, goodbye, basically. And I was like, what? I don't give up on myself. I will find the answer. And then I found the answer, and I found out that there was kind of nothing that they could do except for, well, give me this with some more other ones, and then with a fun package, and then, I don't know, try and support me, but they don't really do anything to help with mental health. And when it comes to life itself, well, health is wealth. So mental health is definitely wealth as well, because without the mental health, you can't even have the physical health really, or be able to enjoy it to its fullest extent. So I would say it's taken a really big toll on my son, actually, who also has Ehlers-Danlos syndrome, hypermobility, and then may have other conditions, because I can already tell he's already having massive panic attacks, and he doesn't quite understand what makes his disease different than other people's diseases. And it's been really hard on him. And we've been on this big roller coaster for like just the past few weeks, actually, where he had like his first panic attack and stuff, like a really big one. And then like I found out some other things that were really not so settling. So it's health is wealth. So mental health is the cornerstone of that wealth.
Yeah, that's very true.
To add to that a little bit, I always say this, and it's stuck in my mind from the very first day I met my specialist, my sarcoidosis specialist. He outright said to me, he goes, you know what, fighting a rare disease will be 90% mental and 10% physical. And it sounds weird because, you're thinking about the physical part aspect of it and you're treating the physical part. But if your mind gives up, it doesn't matter what drugs they give you. It doesn't matter what treatments they give you, physical therapies. It doesn't really matter, because your mind gives up, your body's going to give up. So mental health it has to be part of your full health outlook when you're looking at a rare disease. And that's something that always stuck with me when I think about it.
So when I think of the kind of the health system as a whole, it is a huge, grueling institution, and it is almost a puzzle to navigate in and of itself. And it is a unique experience to have to go through that. And I think we normalize it because we don't talk about it as a society to like, forgive me if I offend anybody, but you know, like the normal people or the healthy people, it's just as simple as going to your PCP. That's being sick. So they don't have that kind of clue in on, you know, referrals and availability and being on the phone, like waiting just to schedule something for like 30 minutes. So it's a unique, grueling experience that is valid to be, it is completely valid to be frustrated and disheartened by it, because it serves so many people and we're just one. And it's, I mean, the healthcare system is past its capacity. And so, and then there's this other factor of, as humans, we like routine. We don't like uncertainty. We don't like change. And that is like the healthcare system, is things are always changing. Nothing's definite. So it has this kind of grueling effect on our mental health and how we like to, you know, set ourselves up in the world. But then there's this isolating fact that people don't realize how much of a puzzle it is. And like Frank said, you know, it's that kind of hope to keep going. I think of my elderly dog. She was in a lot of pain, and it was kind of one of those decisions, do I put her down or not? And ultimately my decision was, when she gave up was when it was time. Now, she used to love breathing in my face, and she would struggle up the stairs, but when she stopped getting up just to breathe in my face in the morning, that's when I knew it was done, because that's the drive. And mental health is the driver to that hope to keep continuing, making those calls, making, you know, those appointments, sitting in line. And without that, it is phenomenally harder to maintain our somatic health. It's a unique experience. It's a big challenge that not a lot of people are going to understand until they have to go through it themselves. So I would, you know, encourage everybody to remember, this is a huge feat that I'm doing. I'm rolling the boulder up the hill.
Yes, completely. And it's different for everybody that as well. It's not like it materializes in the same way for everybody either. I don't know about how many of you waited long times, say, for your diagnosis either. I mean, sometimes, you know, mental health impacts long before a diagnosis can even be given, because you are going through the grueling task of all of that, sitting in waiting rooms and going to see doctors and things and not getting any diagnosis. And it's a real struggle. I can get that. Does Jenny or David, do you have anything to add to that, or can we move on to the next question?
Yeah, just to quickly add, I definitely think it's something that's really important to deal with, as whether you're a patient or caregiver, it's such a life-changing thing potentially to go through. From a caregiver's point of view, the way that impacts your life, and whether you're a patient, whether you're diagnosed, whether you're younger or older, you might have to give up work, your loss of your physical mobility, relationships, and for some of us, bereavement. We've had to face that through losing people to a rare disease. So I think it is something that and also as well, lack of awareness. I think that was a point I wanted to make. You're facing something that not many people know about, and you're also the medical side where you're having to manage something that whether the care is support, you're still having to keep on top of the education and awareness around it, whether you're having to be kind of like promote your well-being a bit more than other conditions that are more commonly known.
Yeah, that's very true. Very true indeed. Jenny, do you have anything to add?
I think I'll just add quickly, I believe that everybody deserves to have a therapist, somebody that they can talk to who is fully there to support them, that is not entangled in their daily life, that is a professional, and that you can just, come to with anything. And I think, as many people have discussed, this journey is a long one for many and changes over time, and to have consistent care, maybe potentially not from a healthcare provider, but from a mental health care provider, that can be really, really impactful. And I do just want to make a plug. We may talk about this later, but the reason I went into family therapy as opposed to different kinds of other therapies was because I really believe that when one person in a family is impacted, everyone is impacted in that family. It's a system and it's interconnected. And so in addition, like many times I'll see people in individual therapy or in family therapy, and they have both going on at the same time, and that's a really great way of addressing everybody's needs as well as your own as an individual. So I'll just leave it at that.
And it's a great segue into this next question, really, because the next question is specifically to Robin and Jenny, to ask you about the role of the caregiver, whether it's a parent, a partner, or a family member. Are we doing enough to support the mental health of people who are in this important role?
I'm sorry, I wasn't certain who would start, but I can start by just saying, as a caregiver and as somebody who has, the same rare disease as my son, and then a bunch more, I can say that it is really gruelingly hard to try and support someone else's physical health, let alone their mental health, especially for my son, because he has an expressive receptive learning delay. So that means that he can't express what he wants to say with enough time, because he doesn't have enough time to process it and then say it back, and so like he kind of forgets what he wanted to say, or he gets too anxious to say what he's trying to say because so much time is like maybe elapsed or something. So that's really hard with my son. But also to try and play, let's take care of Kaiden while mommy's also sick, because like sometimes I have my really sick days where I'm just so very sick that like I can just do my very bare essentials, but then I still have to take care of my son and do all of his ABCs 1, 2, 3s, and then the extra stuff that we need for the future. And I always say vote for the future, because we're taking care of and we're raising the future generations that will help to hold us up when we can't hold up as much on our plates. And I don't just mean individually as families, but I just mean as a society and as societies as a whole. So all the world, everywhere, everybody. So like if we do not support the mental health of the caregiver, then they can't support the care and the mental health of the person they're caring for, which means that in the future, we're not going to be left with, people that are going to be able to go up to bat and, grab that baton. Because like my doctor's been advocating for, this Medicaid issue that we were having in the States for like 20 years. And he's like, I just can't do it anymore. And he's actually my psychiatrist. And he's, the best advocate for me, I would say, but he's like, I just can't do this anymore. And I'm like, I will pick up that baton and I will advocate for this, because you've been doing it for 20 years while taking care of people like me and then also other people. So he's hired me as a clinical consultant. So I do some rare disease diagnostics just to help. But, I have to say that me having mental health care, which I kind of just started to get into because I had begged for it when I was 9. But my mom was very dismissive, and then they just kept sending me from doctor to doctor to doctor to doctor, and eventually I got a psychiatrist, but they spend about 15 minutes with you, and then every single counselor that I go to or therapist says, well, you're doing great on your own and you're doing just great, just keep going. And then I asked my therapist, are they just pushing me off? And he's like, yes. And then he became my therapist, or I'm sorry, I asked my psychiatrist, and then he became my therapist, but then he's like, it's just too complicated. I don't even know where to start. So I'm going to send you this book on PTSD, and we'll go further from there. So I can tell why everyone's so overwhelmed, but I just wish that we would start this from an earlier perspective for somebody with a rare disease, because I had the diagnosis by the age of 15. So they really should have done something.
Yeah, you'd think. Hopefully things are changing in now. So, I had a similar thing. I got sorry to hijack. I got introduced to mental health counselling quite young, at 19, but it wasn't really for the right thing. So even though I got introduced to it, it wasn't the correct type of help that I needed. So it's very complex, I think. Jenny?
Yeah, I mean, we're hitting on so many important points. I think for me, as someone who is straddling both the world of mental health and genetics, I really work to both try to educate mental health professionals about people with medical complications, people living with a rare disease or a chronic disease, what that's like and what kind of extra support they might need. And then I'm also trying to educate genetics professionals about the mental health side of things, because I think sometimes they're like, yeah, they have these issues, but we are not equipped to help them with that. And so I think there's this really big gap, unfortunately. So there are people trying to do that work, but there's not enough of us. But I did want to say, I won't depress people with the statistics about caregivers, but I mean, the research shows it's a really hard role. It's a big burden. It's a hard role, and our society does not do enough structurally, resource-wise, to support people in those roles. And so that is a real shame. And I think a lot of my PhD work was actually focused on couples, parents, either parents who had the disease or parents of children with the disease. And I think something that I did find that was helpful was when those parents were able to kind of try whenever they could to put their relationship or to put themselves first, so that they could take care of themselves, take those breaks, find strengths within one another, so whether you're partnered or whether you have somebody in your life that, you can lean on, finding those strengths that you each can have. So, one person can step forward while the other takes a break, like that kind of shared burden is really, really helpful for couples. Also, trying to find a joint approach. I think I often pay attention to the language that parents are using, whether they use, we are doing this, this kind of joint identity in the face of a very unknown and challenging situation. So really trying to get everybody on the same page, trying to reduce the amount of conflict between family members, because you're already fighting so many things outside your family. So again, family therapy is really important for that. I was part of a panel a while back that we talked about how many folks in the rare disease community are wearing all these different hats and playing so many different roles themselves. And Robin, I think you spoke to that perfectly. But, I think I'm sorry, unfortunately, that those mental health providers were not able to, support you in the way that you needed. But something that is really important is when you are looking for mental health support, to keep looking for the right person. Once you find the right match, as Frank has indicated, with someone he's been with for 11 years, that person can make such a difference in your life. But you do have to find the right fit. The research does show that for there to be good outcomes in therapy, you do need the right match in the person. So I would encourage people to, I know it's work, but keep going until you find the right person.
Yeah, that's great. Thank you very much, Jenny and Robin, for answering that. The next question is for Emily. How has mental health care affected PTSD in rare disease patients?
How is mental health care affected? One more time.
Sorry, I'm trying to speak clearly as well. How has mental health care affected PTSD in rare disease patients?
How has mental health care affected treatment? I think I need a little bit more clarification on the question.
Well,
I can talk generally about medical people. I'm
I
sorry?
I guess it's more like, how does PTSD affect mental health? would be.
Oh, yeah. Thank you. So let's talk about traditional PTSD first. So a lot of the times when we talk about it, we think of veterans coming back from war. And so they may have symptoms such as anxiety, self-isolation, they may have panic attacks, they may have depression, and all of this can be kind of brought back to the war, like how could anybody understand what I'm going through, or the anxiety around, let's say, 4th of July, the fireworks are triggering. There's this thing called fight or flight response, where when we feel like we're in danger, our kind of natural reaction is to either get the heck out of there or fight. So this kind of avoidance is going on. Now, if we talk about rare disease patients, let's say that there is a trigger in your clinic, and I can speak for myself. So before I realized, that I was feeling symptoms of PTSD in relation to being at the hospital, I would be so kind of nervous and pent up that like the entire 30-minute ride to my hospital, I was just getting tenser and tenser, that by the time I walked through the door, I had to have my headphones on, my eyes down, very short responses. I noticed that it was hard for me to remember what was talked about during the clinic appointment because I was in this fight or flight response. I was kind of, just trying to get out of there as fast as I could. And I wasn't able to communicate, my needs as much. And then I would leave the appointment being like, well, I didn't say anything that I wanted to say. Or I would get really angry if I was I remember one time I was trying to match a PCP appointment to a GI appointment on the same day. And I got a call the day before, or maybe like a couple days before, and the PCP assistant was canceling. And I said, well, why is she canceling? She said, well, the physician is going to be sick. Just like, oh, they can, they schedule being sick. And I later learned that her husband is in the Army, about to be deployed. So she was taking Fridays off to be with him before that. But I got so irrationally angry. So it's this kind of quick change in emotion. Again, avoidance, self-isolation. I didn't talk about this with many people because I think a lot of people are with me here when, if you talk about your struggles in the healthcare system, unless the person also has a chronic or rare disease, the other person, they're oblivious to it. They're like, well, I'm sure they're just trying to do their best. And it's like, that's not the point of what I'm saying. Everybody's trying to do their best. So then you have to give this context and this backstory of explaining how the hospital works and the situation, the context, before you can even explain what's annoying you. So there's that self-isolation where I didn't talk about it. And once I kind of realized what was going on for me, it kind of alleviated a lot of that, because I realized this isn't me being a difficult patient. This isn't me being, neurotic, even though I am a little neurotic, but I'm not. This is a trauma response. This is a response to previous trauma and me trying to avoid trauma again. And what's unique about rare disease and medical trauma is that we can't get away from it. Like veterans, the war is over. We're at risk for repeated re-traumatization. Now I'll say that how I realized I had medical PTSD is a unique story. I work in behavioral health, and I kind of, was realizing a lot of the symptoms that my clients who had history of trauma, like their responses, although weird to other people, I was like, no, I get it. And then that was kind of like me thinking like, have I experienced trauma? And then, well, maybe the healthcare system, that's been a big part. So I realized that I have medical PTSD in this kind of non-traditional, or there is no traditional way of figuring it out, I suppose. But in this way of doing it through work and self-reflection. For anybody out there that was wondering how I figured it out.
Thank you very much. It sounds very complex, doesn't it, when you put it like that? It's I mean, when you can't figure it out for our own selves, it's how can you ever expect anybody else to figure it out as well? And that's the other side of the coin, when you're locked into your own kind of condition and position as well. Does anybody have anything to add? Would like to say anything before we move on to the next question?
I'd like to quickly add something. Just I also have PTSD actually, and I've never actually been on a panel yet, you know, about mental health, and I just haven't actually met anyone else with PTSD. So I just wanted to say that when you said, you know, the veterans leave the war, I never even realized that, you know, the reason why I've been stuck in this fight or flight response basically my whole life, because people say that I'm either fight or flight, you know, because I'm always, you know, revved up and ready for the fight, or I'm out of there, because I've just been stuck on this cycle of just either being ready to fight or ready, well, to flight. And that's because the rare disease follows me, and, you know, the issues follow me. And that's why people are always like, how did you figure that out? And they're like, my doctor's like, how did you realize that? I'm like, well, that's because I'm kind of cheating in a way, because my diseases are following me, so I can study myself, you know, like as I'm getting older. But that also leads to this, yeah, redoing of like the medical trauma and stuff, and then of other traumas, just from being around things that were similar, or experiencing something that was similar, or knowing somebody that experienced something that was similar. So to have a rare disease and PTSD is incredibly challenging. I just have to say that it's like upping the ante a little bit. So I just wanted to add that. Thank you though.
Thank you very much.
Yeah, I was recently in the ER for food poisoning, and kind of what you said, revved up to fight. I was ready to be like, this is what I need, and this is what I need, and this is why. And so I, you know, like feeling like I'm dying from food poisoning, because food poisoning is just one of those things where you're like, this is it. I was like, I need fluids, I need CBC, I need Tylenol. And the doctor just sat down and she's like, yeah, that sounds good. And I was so surprised, because I was like, wait, I didn't need to fight you. And then other times I'm just like, I'm mentally out of here. Whatever you want to say, but I'm gonna do what I'm gonna do.
Yeah, thank you very much. Moving on to Frank and David, and the topic of mental health for men. Would like to tell us whether or not you think that there's still a huge stigma around mental health for men, and sorry, and if you do, what do you think that we can do to improve it?
Yeah, I think there is still a stigma. I think things are improving slowly, but I think there's a number of things that we can do to change that. I think having a male support groups like the one I do is a small start. Having conversations with people, men having conversations with their partners, family members, people that they work with, if they work with a rare condition, is another start, but also medical professionals as well. I think it kind of needs a bit of a collaborative effort, really. But I think to be more comfortable around talking around mental health, we need to sort of like all be a bit committed to kind of putting in some effort into having better conversations around it all to make better changes in the long term.
Thank you, David. Frank?
Yes, actually, there's two things with this. First, the stigma for men, it's always been, you know, unfortunately, the stigma of the male is supposed to be the person who is the strong one. And unfortunately, it carries on. But there's also a stigma within backgrounds as well. Like whether, like I know from being Hispanic in a Hispanic background, they do not push, especially for men. Men are supposed to, you just suck it up. That's exactly what you get told. You don't, you know, if you go to see somebody for counseling, you're actually looked down on. You were not any, getting better as we're going now. But so us as advocates and dealing with rare disease also have to separate, like I said, the male stigma and well as the cultural stigma, and make sure that we address both of them. Because I always say you're not weak to ask for help. You are strong when you ask for help, and people have to understand that. I mean, I don't want to say the weak way out is, you know, the suicide and all that, but if you're asking for help, you want to better yourself, and that's what makes you stronger. So I always preach to every you know, every person I talk to about mental health, whether it's male, female, and I try and my goal is to stop separating male and female, and it's just patient, or it's just caregivers, it's just the community. Bring us the community together, and we're all one, because we all have the same problems. And that's what people have to understand. Even though we all have different rare diseases, a lot of the mental aspects are all the same, whether you're male or a female.
I mean, I think definitely for men, taking care of your mental health, and for women as well, you don't need to, you shouldn't really leave it till you're too far down the line with your mental health. It needs to be part of a more of a regular routine and keeping on top of it, really.
Yeah, and I think as well, and you know, a lot of people forget this, that you know, an illness is the same no matter where you are on the globe as well. It doesn't actually matter where you live. Demographics don't necessarily change the illness. The illness is still the same, whether it's the rare disease or the mental health issue. Sorry, Frank, I didn't mean to butt in there.
Now, the other thing I was going to say is also, like Jen said earlier, about finding the right person. It's okay to try to find another therapist. I know it's limited compared to how many people who have rare diseases or families, and I understand that, but you need to find that right fit. If you don't find that right fit, you're going through the motions. You really are. You're not going to accomplish as much as you want.
Yeah, that's very true. Do any of the ladies have anything to add to that question? Robin, do you have anything to add to that? Being the caregiver of
I would love to actually. I'm sorry, can you just repeat the question one more time, just so I can keep it fresh?
It was just about whether or not there was a stigma around the mental health for men, and what could be done to improve it. Can you see something there that would, and I know you touched on it earlier.
Actually, I can see that definitely my son, just because I know, like with his dad and his dad's family, and my family is just, well, me and my son, and then his dad, which is part of the family, but we're, you know, trying to co-parent, so it's a little bit different. That, you know, on their side of the family, that it's very taboo for my son to ever get upset or to feel, I don't know, not respected, you know, and people always just kind of dismiss it and stuff. And like his teacher actually was like, well, your son just didn't want to learn today and stuff like this. And I was like, well, actually, he's got, you know, a learning disability that's an expressive, receptive speech delay. And then also he has rare diseases. So he just, you know, he was having problems with keeping up. So it's not that he didn't want to do anything. It's just that he told me when he got home what had happened. So that's why I tried to explain to her. And then she still didn't understand. And I was like, well, this is just kind of a mental health thing, because like he can't, you know, express himself well enough. And that leads to him feeling really shy and then just not wanting to express himself anymore, because he just can't, you know, get it out. And then he feels defeated and frustrated because, you know, his teacher thinks that he just doesn't want to engage. Mind you, he's only in second grade, but still they're really hard on them now. I remember when I was in second grade, it was not like this, but I can definitely see that there is still a stigma around it. But I think that we could improve it a little bit by, I don't know, including, you know, like we're doing right now, like a panel, you know, of people that are, you know, have mental health issues, you know, or, you know, can at least see the deficit in having a rare disease and a mental health problem. And then, you know, if we just have maybe just one other female on like the panel or something, I think that would improve it. Just because I can see that all of us together we're talking about the same thing, but I can see the difference between the males and the females, but I can also see that we are all together as a family, you know, like we're all linked together, and that we all together make this puzzle fit. And without one of us, I don't think it would fit that well.
That's good. Anybody else got anything to say on that? Nobody?
I just
Okay.
appreciate the work that Frank, David, and Adam are doing to normalize this for men and to provide spaces to talk. That is so, so important. Yeah, thank you for your work doing that.
Very much so. It's fantastic work that they're doing. And I want to move on now to everybody on the panel. How can we improve mental health for people around the world? And where, you know, whether or not you're looking at education, awareness, or should there be some kind of universal guidelines? What do you all think about that? And who would like to answer first?
I say it's hard to have a universal guideline because each person is different. And so, I mean, and my thought of how we could help this is I think patient organizations need to be more involved. I really think that's where we and I include myself because I, as a patient advocate and as an organization, need to step up and try to find better, more improved ways. I talked about this earlier with Jen. Stop pointing at the problem, you know, be part of the solution, not part of the problem. So that's where we need to step up as as leaders and trying to find out different ways. And don't think inside the box. We need to stop that. We need, as organizations, we need to stop thinking inside the box. Otherwise, rare diseases would be gone by now. My rare disease has been around 200 years, okay? And we still don't have a cure, or we don't even have a cause, okay? So why start thinking of new, improved, different methods that may work. If it doesn't work, at least we can learn from it. You know, I mean, I never say you fail by trying, you fail by not trying. And that comes especially with mental health, because this is something that's just catching on now. It should have been something that has been around for a long time, but we should be able to, you know, maybe have committees and stuff, start joint, you know, have joint committees and start figuring out what can we do to help, because we are patients, we are caregivers, we are family members, we are therapists, you know, what can we do as groups to help instead of just pointing at the problem?
I like Ad Medicum's comment there where they've written what's needed, more resources for suicide prevention, like national number being started in the US, more trained professionals coming from diverse backgrounds, more people talking about it, like this event. And, you know, in essence, you know, it's reality, that, isn't it? It's very, very true. Anybody? Emily, do you have anything you would like to add? Jenny, anybody?
Yeah. I agree that there's no one box that fits all, but I think something that should be done is more training in general, for all kinds of positions. I mean, I think doctors should, you know, go through more training in medical school about the impact of mental health on, or chronic, acute, any kind of illness's effect on mental health. I think there should be, and nurses and all kinds of providers should be aware of, you know, signs of depression and suicide and what to say. I find that the suicide screening, so quick story, I once had a trigeminal nerve pain in my jaw, and I didn't really think of it. So I just took a bunch of Tylenol. It was Tylenol that I happened to get in France because I went to France and I had Tylenol left over, and I was chronically dehydrated, and it was ibuprofen. So ibuprofen is filtered by your kidneys. And so I went into acute kidney failure and was hospitalized. And, I told them I need some kind of, Tylenol or something because the pain always comes at night. And it was like the worst pain I've ever had. And so they didn't put in the order, and, we're paging the doctor over and over again, and she's not showing up. And I actually happen to have ibuprofen in my purse. So I called the nurse and I just said, if the, on-call doctor doesn't get here in 10 minutes, I'm going to take this ibuprofen. And they interpreted that as a suicide threat, when I was just like, look, I need you guys to take care of my pain instead of putting it off for like 3 hours. So the next day, they suicide screened me, and it's a very different thing than how we do it in my company. It was very sterile. They were definitely very afraid to ask these questions. They were not trained. They were not equipped. And so having providers have the training to feel more confident in asking those questions, but also even like managers, supervisors of different industries, I definitely sharing stories or saying like, oh, sorry, I can't do it. I have my therapy appointment, or, little things like, oh, my therapist said, and just not, instead of just saying, oh, well, I heard this and that, just like normalizing it by talking about it more, but additional training to support those who may need to ask those questions.
Thank you very much, Emily. Right, I've just noticed the time. I'm sorry, Jenny. We've got 3 minutes left, and basically it would be very rude to not finish with asking you all to, what's your call to action for mental health? Very, very quickly, quick fire to go around, please. And who wants to start that off?
Yeah, I'd just like to see mental health treated the same as physical health. That's my quick one.
I was actually going to say something really similar for the last question. Get involved in research, be engaged as a patient in research organizations like the NIH or equivalents, because they determine where research funds are going, whether that's to developing these types of resources or whether there's more and more millions poured into genomic technology. I think if you can get involved from the beginning of the research pipeline, that is also really, you have an important role to serve in that as well.
Yeah, that's very true. Who would like to go next?
I will go quick. One thing that we did as an organization, and I really think that's what I've talked about organizations being a part of, is I actually contacted online therapy organizations, and they gave me percentage off for my for the community. So why not be proactive and call them up and talk to somebody? I got a response from the CEO of onlinetherapy.com. And they gave my community 20% off of their copay. It's something. So don't be afraid to be that squeaky wheel and to call people.
If you don't ask, you don't know, do you? If you don't reach out and you don't ask, you're never going to know whether or not that help's going to be there for you. So that's a very useful advice. Emily, Robin?
Yeah, I would just say, oh, go ahead, Robin.
No, you go ahead. Go ahead.
I would just say, communication on how we feel, communication on what's working, what our needs are. Like what was just said, if you don't ask, people will never know. You got one life. Ask for what you need.
Mm-hmm.
That's it. Thank you.
Thank you.
I was just going to very quickly say, because I know that we're short on time, that I want to repeat that, you know, don't be afraid to be the squeaky wheel, because I've always been the squeaky wheel, and that always has gotten me those inches farther that I needed to go. But I think that it would be best, honestly, if they just included mental health in every single profession, you know, like, so say you're a PCP, you know, they include mental health and they, you know, ask questions and stuff. And, you know, say you're, I don't know, a geneticist, but, you know, they include mental health because they should know that a rare disease diagnosis or any genetic disease diagnosis is going to be really hitting hard. So they should really be checking in on that. And instead of them jumping to conclusions, because I was actually kind of surprised, but not too surprised to hear that they jumped the gun. They were like, oh, this is a suicide thing. Maybe just realize that the patient is just trying to say, listen, I need these things because I need these things, and I, you know, will do whatever it takes to get them. You know, so it's basically all she was saying was like, look, I need the things that I need, and I'm just trying to make you guys aware of that. But they shouldn't just be like, oh, suicide threat, and then no, that's not at all how to handle that. So maybe some more training on how to handle those types of things and how to know when it's a suicide issue versus just as somebody can't take it anymore and we could just give them some Tylenol issue, you know.
Yeah, that's very true. It's also very important to remember as well. And it would be good if it could be viewed more broadly and not just kept in that niche. It's a very delicate topic for not just for the patient but also for everyone around them as well. And I would like to kind of thank you all very, very much for sharing your parts of your lives, your journeys, your experiences with everybody today. And I'd like to also remind everybody that May is Mental Health Awareness Month in the US. And we are all, even David and I from the UK, supporting that advocacy campaign throughout the month of May. Thank you all very, very much indeed for joining us. And well, enjoy your weekend. Thank you.
Thank you, Carole.
Thanks, everybody.